Right now, there's a terrifying medical crisis unfolding right in the middle of the Atlantic Ocean, and we are tracking it by the minute. Welcome to This Explainer. Today, we're bringing you a gripping, high-stakes investigative report into an active emergency at sea. Picture this, a luxury polar expedition vessel, the MV Hondius. It was supposed to be a dream vacation, right? Well, it's literally transformed into a floating hot zone. What authorities initially thought might just be some routine seasickness has rapidly, and I mean rapidly, escalated into a full-blown international incident. We're talking multiple countries, the World Health Organization, and a microscopic pathogen with a genuinely terrifying mortality rate.
3. That is the shocking number of confirmed deaths so far in this bizarre, rapidly escalating outbreak. 3 perfectly healthy tourists who boarded a ship for the trip of a lifetime are now dead. And health authorities, they're scrambling to figure out why. You see, this isn't just some localized tragedy. It's a massive medical anomaly. The pathogen at the center of all this is called Hantavirus, and here's the thing. It traditionally does not strike in the middle of the ocean. No way. And yet, the body count is very real, and the danger is still incredibly active.
So, what exactly is happening? What started out as an elite luxury polar expedition has completely devolved into an international maritime quarantine. The MV Hondius, which is operated by the Dutch company Oceanwide Expeditions, is this heavily ice-strengthened vessel carrying about 150 tourists and a crew of 57. Right now, it is effectively on total lockdown. The ship is just sitting there, anchored off the coast of Cape Verde, which is an island nation off Africa's west coast. Local authorities are, understandably, being incredibly cautious. As of the latest reports, absolutely no one is being allowed to freely disembark. They are, for all intents and purposes, trapped.
Let's trace the geography of this nightmare just to really understand how isolated these people are. About 3 weeks ago, the ship departed from Ushuaia, Argentina. That's way down at the very tip of South America. They were making planned stops in Antarctica and the Falkland Islands. Sounds amazing, right? But mid-voyage, disaster absolutely strikes. The first passenger falls critically ill and actually passes away as the ship is passing the remote British territory of St. Helena in the South Atlantic. From there, the ship just continues this desperate trajectory northward toward Spain's Canary Islands, eventually having to drop anchor near Cape Verde. If you think about their route, they are literally surrounded by thousands of miles of open ocean. They are so far from any kind of definitive mainland rescue or massive hospital infrastructure.
And the timeline of these casualties, it's terrifyingly rapid. It's exactly what set off alarm bells at the World Health Organization. First, a 70-year-old Dutch man suddenly develops a fever, headache, abdominal pain, and diarrhea. He deteriorates so fast and dies right there on board. His body is offloaded in St. Helena. Then, his 69-year-old wife, who is making her way back home, literally collapses at an airport in South Africa and dies shortly after in a nearby hospital. Next up, a 69-year-old British national falls severely ill near Ascension Island and requires an emergency medical evacuation all the way to an intensive care unit in Johannesburg. And we now know a third Dutch passenger has also died. This rapid, lethal progression, it's the absolute signature of a devastating pathogen.
Okay, let's dive into this microscopic killer. Laboratory tests have confirmed at least one case of hantavirus, pointing to a condition known as Hantavirus pulmonary syndrome, or HPS. Listen, this is not your standard cruise ship norovirus, okay? HPS is a severe, life-threatening respiratory disease. It actually first gained major attention in the Western Hemisphere, back during a really deadly outbreak in the American Southwest in 1993. It even made headlines again recently when it tragically killed the wife of Oscar-winning actor Gene Hackman. But to really grasp why the WHO is so deeply concerned right now, we have to look at exactly what this virus does to the human body.
Methodically, here is the clinical breakdown of the infection, and it's pretty gruesome. It starts out deceptively, almost like the flu, a fever, muscle aches, maybe some nausea. But within a matter of days, it shifts into this terrifying cardiopulmonary phase. The virus essentially attacks the vascular system. It causes what's called pulmonary capillary leakage. In simple terms, the tiny blood vessels in your lungs basically become porous. Fluid just floods right into the lungs. The patient begins to literally drown from the inside out. And that leads directly to cardiogenic shock, respiratory failure, and the heart's inability to even pump blood.
Which brings us to an absolutely crucial point, the case fatality rate. For hantavirus pulmonary syndrome, it sits broadly anywhere between 30% and 60%. Just let that sink in for a second. Depending on the exact strain, up to 6 out of every 10 people who develop severe symptoms simply will not survive. Death typically happens incredibly suddenly, often within just 2 to 10 days after the severe illness sets in.
This astronomical mortality rate illustrates exactly why global health authorities are in a deep panic over a cluster of cases trapped in a closed environment out at sea.
And to make matters worse, doctors are facing a massive medical gridlock here. There is literally no magic bullet for this. Dr. David Safranetz, the Chief of Special Pathogens at the Public Health Agency of Canada, highlighted this chilling reality. He stated clearly, there are no specific vaccines for hantaviral diseases. There are no specific antivirals to treat the disease in humans. Treatment primarily is supportive care. That means all doctors can really do is put patients on ventilators, monitor their hearts, maybe use blood oxygenating machines like ECMO, and just pray the patient's own immune system can fight off the virus before total organ failure kicks in.
So, this brings us to the core mystery of this entire investigation. The standard transmission for hantavirus is almost exclusively through rodents. People usually get sick by inhaling aerosolized dust from infected rat or mouse urine, feces, or saliva. Typically when you're sweeping out an old barn or dirty basement. But the MV Hondius, it's a modern, heavily sanitized luxury polar vessel completely surrounded by the Atlantic Ocean. So how on earth did a virus that relies on mice and rats infect so many people out in the middle of the sea? Did a contaminated rodent somehow stow away in the ship's food stores? Or are we looking at something much, much worse?
Well, there is a geographic puzzle piece here that builds a truly terrifying theory. Remember where the ship started its journey: Ushuaia, Argentina. Now, Argentina happens to be home to a very specific strain of hantavirus called the Andes virus. Unlike almost every other hantavirus on the entire planet, the Andes virus is the only one known to have the capability of spreading directly from human to human. We're talking close contact, saliva, or airborne droplets from just coughing. If a passenger contracted the Andes strain back in Argentina before boarding, well, they could theoretically be spreading it directly to other passengers through the ship's narrow corridors and dining halls, entirely bypassing the need for a rodent.
Which brings us to a really chilling realization about the present moment on that ship. Microbiologist Susie Wiles summarized the dread perfectly when she asked, "With this incubation period, are we going to see more people coming down with the disease in the next days and weeks?" You see, the initial cluster of deaths might just be the tip of the iceberg here. The most terrifying threat is the one that is currently hidden below deck, quietly replicating. And that hidden threat exists solely because of this window right here, 1 to 8 weeks. That is the incubation period for hantavirus. A passenger could be exposed to the virus, whether from a random rodent on board or just a cough from an infected neighbor, and they could walk around feeling perfectly fine, eating at the buffet, taking photos on the deck, for up to 2 full months before the fever finally hits. This massive incubation window means that perfectly healthy-looking passengers and crew currently anchored off Cape Verde could already be harboring this lethal virus, just waiting for the biological clock to tick down.
So where does this leave everyone on the MV Hondius right now? Well, it's a high-stakes medical gridlock. Around 150 tourists are still isolated on board, and most critically, at least 2 crew members are currently symptomatic and urgently require medical care. However, the local health authorities in Cape Verde are absolutely terrified of importing a lethal outbreak onto their islands, so they have so far denied authorization for anyone to disembark and go to a hospital. Meanwhile, the WHO is conducting a full-scale risk assessment, and South African health officials are frantically running contact tracing in Johannesburg to see if the deceased passengers might have spread the virus at the airport. It's a logistical nightmare.
We are quite literally witnessing a live, unfolding medical thriller. A luxury ship is paralyzed. 3 people are tragically dead, and the world's top health organizations are scrambling for answers. We are left with this haunting, unresolved question: are we watching the deadly, rare human-to-human spread of the Andes strain? And as the MV Hondius sits anchored off the coast of Africa, how many more passengers are secretly incubating a lethal pathogen in the middle of the ocean? We're going to continue to track this breaking story right here. But for now, the voyage of a lifetime has become a desperate fight for survival. Thank you so much for joining me for this explainer. Keep questioning, and please stay safe.